So I've been trying to focus more on my mental health lately, and something that's been really illuminating for me is figuring out that you can have genetic drug interactions, especially with like antidepressants and anti-anxiety and antipsychotic medications. And that's why like most of those medications have never worked for me. Sort of notoriously. And it's always been very confusing, and I didn't have to go through a long trial of these. It was just like I had some really severe reactions to like at least four of them. And my nurse practitioner ordered like a genetic test, which I highly recommend if you're considering going on these medications, because what it showed us is that I don't process medication the same way that everyone else is. And my test results for genetic drug interaction were so high that the company called my practitioner, which they never do, and they said, don't put her on anything, which was like insane. So one of the reasons why I have such problems with it is because I don't process folate very well, and folate is really important for processing endorphins and like serotonin. So the things that make you happy, the chemicals that make you happy. And I found that out a few years ago, and like the practitioner at the time told me to take folate. And so I did, and it didn't really seem to help. And in fact, sometimes I get like the same symptoms of when I was on the antidepressants. And so recently, my therapist kind of talked me into going and just trying out medication again and being like, maybe you could use a PNR, which is like a type of medication you take as needed for like panic attacks and things like that. And so I did get that, but the person that I was talking with, she was like, hey, like these are pretty crazy results. And luckily, like for you, I have decided to like specialize in this. Like it's a special interest of mine, and it's just like something that I've done continuing education on. And she said, actually, folate and enriched foods you need to stay away from because it'll just make you feel worse. And the reason why, obviously these medications don't work is because you aren't getting folate into your system. And so something you can do is take methylfolate. Methylfolate. Sorry, I didn't say that very well, but like I started taking the supplement. She just recommended it. And she said you probably won't feel effects for like 4 to 6 months, but I've been feeling like better in the past few days. I don't know. Maybe it's just placebo effect, but like I really hope things get better, and I really hope that we can kind of find medications that can kind of work around these things. And also, if you've ever struggled with medication, maybe you should give the test a try. It really helps, honestly.